Tammy is a registered nurse, and prior to that, she was a surgical tech here. So she's well trained, and on top of that, and probably just as important as her training, Tammy is one of those people who sees what needs to be done and does it. And in this particular case, this patient had a very rare thing happen, and Tammy recognized it and jumped on it immediately.
And Molly came in labor. At that time, Tammy had informed me that she thought Molly was abrupting, and Dr. Rabin was called, and we rushed Molly back to the operating room where Tammy, Dr. Rabin, and anesthesia arrived, and we proceeded to do a emergency C-section and get the baby out.
When I went back to our C-section room to check on what was going on back there, Molly was already very pale. She had lost a lot of blood. Tammy had come out by that time with Lincoln and was in the nursery, and they were starting IV fluids, antibiotics, and had him on some oxygen.
When I went back to check on Molly, they had told me that it didn't look good. Her blood pressure was dropping, and Dr. Rabin was working, and Tammy had stayed because her prior experience as a surgical tech paid off, and she had helped him with a C-section. We did stabilize her and was able to move her to the intensive care unit.
And like Teresa had said, we do not staff 24-hour surgery crews. So Tammy taking that initiative to go back and set up the OR to get Molly back there to deliver was, I mean, that's what worked, that's what saved her.
She did everything that she knew that she could do to save his life and my life that night. And she knew that there was something wrong, and she knew to go to the operating room, and she had it all set up and ready to go. When Dr. Rabin was there, she was by my side every single step of the way.
She keeps a cool head, and it's wonderful to have somebody like that backing you up in a situation. And I mean, she just jumps in, knows what to do, and does it. And then we all just take a breath afterward.
Patients are different, and everyone brings their unique situation to the foreground, and as a healthcare professional, and in this case, as a nurse, Tammy had to recognize that and deal with that circumstance.
Tammy's quick thinking and knowing the signs of what to look for when things took a turn for the worse was what saved Molly and Lincoln.
I'd like to say that it's an honor to be nominated for the Georgia Hospital Association Hero Award. And I'd like to thank all my fellow employees, but most of all, I'd like to thank my family, my husband and my children for supporting me for all the times, the long hours and the working. And I want to thank my sister, who's been a major part in my life in the decision of becoming a nurse. I'd like to thank all the people that has had a part in making me the nurse that I am. And I just pray that I continue to be an asset to Stephens County Hospital and to our community.